So we're just waiting for this to download. And in the meantime, I just wanted to give a little talk on vaccination and why we do it. And I like to start with the point that we're trying to make and why Dr. Watnick, as the CMO, asked that all the medical directors give a talk on influenza vaccine. And I think the main point is herd immunity. And so if we're trying to protect patients, if we can vaccinate the patients and prevent spread of influenza from staff to patients, or from patients to staff, or from patients to the doctors, or from doctors to the patients, then the more people that are immunized, the less likely that the virus can be passed around. And so there will be less incidence of influenza. And in this talk, we'll talk about the myths of vaccinations. How many have heard the story that vaccinations could cause autism? Anybody heard that? So does anybody know how that story got started? So it was a scientist who actually had a conflict of interest because he had an interest in the vaccine maker. And so he published some data that said, actually, he had an interest outside of vaccine makers because he was against vaccinations. So he published some data that suggested there could be autism, but unfortunately he fabricated the data. So then it was published, and then he was discovered, and he was censured. He lost his license, and he admitted he did the wrong thing. And they even send out information recanting that this data is inaccurate. But nobody read any of that. They only heard the first report of the fabricated data. And so that's how that got started. And it's still around. I mean, they haven't been able to undo it. But the guy who did that was really suffered because he ended up losing his license and couldn't practice. And it's really a bad thing for him, but it was a really bad thing for all the people that don't get vaccinated because they're worried about autism. Is that it? Yes. Oh, good. And this works? Okay, so myths about vaccination. Second, what a vaccine is and how we make it. Why the influenza vaccination works, and why vaccination and this principle of herd immunity actually protects patients, staff, everybody. And then potential risks, because there are risks. There's no such thing as a free lunch. Every time you get some benefit, there's always some risk. The situation is that the benefit is much greater than the burdens, though. And then a summary. So first, the myths about vaccination. And so the first is I could get flu from a flu vaccine. And you cannot get flu from a killed virus vaccine. And the whole point is the virus has a protein coat, and the antibodies that we make after we've been vaccinated are against the protein coat. But the virus itself has been inactivated. I have to say there used to be some inhaled attenuated viral vaccines. I don't think those are available anymore. But those live virus vaccines, actually, you could get the flu from those. And for people who are immunocompromised, such as a kidney transplant recipient, we never use live virus. So there still are some, not influenza vaccine, but for example, the shingles vaccine is an attenuated virus. And so your kidney transplant person should never get that or be around people right after they received it. Okay, so second, my child could develop autism from the vaccination, and that's just not true. The only data ever published to suggest that was fabricated. So the third point, if I have an organ transplant, flu vaccination could be harmful. I think this is one of those situations where the benefit is greater than the burden. So all the transplant programs recommend that their patients get vaccination. And in theory, somebody could develop an immune response that went after the kidney or something like that. but it wouldn't be because they got flu. It would just be because their immune system got revved up. But that all the organ transplant programs recommend flu vaccine for kidney transplant recipients. So next point, what a vaccination is. So sometimes it's easiest if I put people have participation. So who knows how a vaccine works? Anybody daring to tell us about vaccine works, how it works? And I can start off by saying the immune system recognizes a protein signature. So anybody thought about this, how vaccine works? What we're doing is we're just injecting killed virus, so it's viral protein. It's got the protein signature of the virus. So the immune system recognizes that protein, and it'll make antibodies. And so the antibodies take care of anything that has that protein signature. So if there's now a live virus with that protein signature, then the antibodies cause the virus to aggregate, and then the T cells can come and clear it away. So the vaccine may be made from a living virus, but we're only using killed virus here at the Kidney Center. An attenuated virus, inactivated virus, which is the flu shot vaccine, and it doesn't cause infection. So how do you make a vaccine? The first step is you have to grow the viruses. And so they're usually grown in egg cultures, because eggs are really good. They're good for us, give us good nutrition. They also are good for growing viruses and bacteria when you want to grow them. So then the viruses are harvested, and then they're put through a process that kills the virus. And it's really hard to purify all of the egg from the virus. So that's why, since there's a little bit of, could be contamination of egg in this killed virus soup that's going to be used for the vaccine, that's why persons who are allergic to eggs shouldn't get the vaccine. So we harvest the virus, it's put through a process to kill it, and then we use that killed virus material to make a vaccination. And this talk says this year's vaccine has 4 viral particles in it. That's partially true. If you can get your hands on the called quadrivalent vaccine, that's what's recommended by the CDC, especially for people who are immune compromised or over age 65. But it's in short supply. So there's a lot of trivalent vaccine, and I think that's mostly what is available and is being used. And this other issue, this year's vaccine does not contain thimerosal. So thimerosal has a little bit of mercury with it, and they had to use thimerosal as a preservative. So when you use multi-vial or multi-dose flu vaccine, it had to be preserved so it wouldn't get contaminated. The only vaccines that didn't have thimerosal were ones that were single use, so they didn't need to put a preservative in. Well, now they've figured out a way to do it without thimerosal, so that's good. So why the vaccination works? Well, we talked about this, that the immune system gets exposed to the viral protein. It takes 14 days to make antibodies, and so then when the immune system sees a virus protein, it remembers it. So then it works right away to clear the viral particles so you don't get sick. So this is a great picture because it shows how the patient gets vaccinated, and so you're stimulating the B cells with the killed viral protein. And so the B cell cranks out these Y-shaped particles called the antibodies, and this is a demonstration of the antibody causing binding of the viruses together and inactivating the viruses. And that's what it is. It also explains why if someone has been vaccinated, if they do get the flu, they can fight it more quickly because they've already got antibodies, and so the viral load will be lower. So why vaccination is essential, showing somebody sneezing and how far these particles can go with a sneeze. They go out for many feet. And so if you're the unfortunate person coming along and the virus settles on your mucous membrane of your nose or throat, then it's a great place for growing more virus. And of course, if you've been vaccinated, then you immediately have antibodies that can start neutralizing those viral particles. So this is a diagram of illustrating herd immunity. And so in red is the patient, and then in yellow are the staff who are taking care of the patient. And so you want, first of all, you don't want the patient to get it in the first place. You don't want the patient transmitting it to staff. And you don't want the patient transmitting it to the doctors. And so everybody in this group, if they're vaccinated to a high degree, and here at the Kidney Center we're more than 90% vaccinated. And with the doctors, I don't know if it's, it might even be 100%, because as far as I know it's a requirement that you get vaccinated. So if people are vaccinated, then the patient is really isolated. So even if they do get, they have a weaker immune system, and the flu vaccine is only about 59% effective. It varies from year to year. So even if you got the flu vaccination, it doesn't guarantee you won't get flu if you get exposed. And somebody who's immune compromised doesn't make antibodies as well, and so they're more likely to get it. And somebody like a healthy staff member who can make lots of antibodies is more likely to be in the group that doesn't get influenza, or if they do, it'll be a very mild case. So this is just to emphasize that everybody's got to get the vaccination. And so so why does everybody, what's the seriousness of the influenza? So it will cause about 200,000 hospitalizations each year, because people are, that 200,000 got so sick that they couldn't be managed outside of the hospital. And when you first are exposed to influenza, you could be spreading the viral particles around for up to 2 days prior to developing symptoms. So that's another reason why it's really important for everybody to be vaccinated, because you could be spreading the virus before you even know you're infected. And so if there's a declining incidence of vaccination, then we're putting our patients at risk. And so think about this. When everybody at the Kidney Center is vaccinated, there's really no place for the virus to go. And so the whole place gets to be a safer place, and it's safer for all of us. So reactions to the vaccine. So the vaccine causes an immune response. So you can have all of the symptoms of influenza from the vaccine, because you're making antibodies against the viral particles. And so this includes soreness at the site of the injection. I mean, you could have hoarseness, itchy, sore eyes, cough, fever, headache. Did anybody get these symptoms from their flu vaccine this year? Yeah. So how high did your fever go? Yeah, that's pretty miserable.
Horrible.
How long did it last?
All weekend.
All weekend, so 2 days.
Yeah.
Okay. But then it just went away, right? And have you ever had flu before? And how did that last more than 2 days? No, usually it does last more than 2 days, but in theory, so you're still doing the thing that by getting the vaccination, you're making it so you can, if you do get flu, you can recover more quickly, and hopefully you're in the 59% that has a good immune system, and you're not going to get sick to begin with. There are some more serious problems. So one of them is Guillain-Barré syndrome. How many have taken care of a patient in the hospital who had Guillain-Barré? It's really very frightening because they are literally paralyzed, and sometimes they need to be on a ventilator. They usually recover, but it takes a long period of time, and it takes a while to rehab. Once you've been motionless in bed for a couple of weeks, you have to learn to walk again, and it's pretty serious. So that is a complication. And how many have heard of the National Vaccine Prevention Injury Act? That so if you got a vaccination here at the Kidney Center and you ended up with one of these complications, if they could document where you was given, what the lot number was, then the federal government has money set aside that they would give to you to cover all your expenses related to having a complication from the vaccine. And the whole point of that was to, we know the benefit is greater than the burden by giving vaccinations. So in those few who end up with the burden of a complication like Guillain-Barré, in order to mitigate and get more people to take the vaccine, made all these funds available to cover people. So if you ever get Guillain-Barré, you're covered.
Dr. Ochi, so if you do get the Guillain-Barré, are you required to get vaccinated again?
No, you don't do it.
Yeah.
So once you've had Guillain-Barré, don't do that again. And yeah, anybody who's had Guillain-Barré, they're never doing it again. We don't recommend doing it. Okay, so the other contraindication is if you have allergies to eggs. And so the summary is that influenza is very serious, and it's even worse for dialysis patients. They're at more risk because they're immune compromised. So the immunization provides memory to fight off infection. And so patients, staff, and doctors, by becoming immunized, cause this phenomenon of herd immunity, and we protect each other. Immunization is called an insurance policy for that reason. There are very few medical reasons not to receive the vaccination, and the benefits far outweigh the risks. So, this is my last question. Oh, no. So this is the statistics from the Kidney Center for percent of staff that got vaccinated. So well over 90%. Looks like our peak year was 2013 when we had 96%. I don't know why we don't have 2015 and 2016 statistics, but they're probably getting better. So now, this is my final question. Who knows where that is?
Cambodia?
Yeah, have you been there?
Mm-hmm.
So when were you in Cambodia?
12, 13 years ago.
Okay. So this is, do you remember the name of it?
Angkor Wat?
Yeah, Angkor Wat. So this is the largest religious structure in the world. And guess when it was built? Any takers? It was built in 1100. And so this is in a city, Siem Reap. And so in 1100, Siem Reap was the largest population center on the earth. They had 1 million people there back then. And Cambodia was a very big country. It encompassed Vietnam, Laos, Thailand. That was all part of the Khmer, Khmer, some people say Khmer kingdom. But this is Angkor Wat at sunrise. And all of these, there are 5 towers to this Angkor Wat temple, and all the walls are just have these intricate carvings in stone. And then this moat that goes around it is a mile long on all 4 sides, and it's amazing. And then to think it's 900 years old. So this is what's called UNESCO, United Nations something, World Heritage Site. You know. Okay. Any questions? Okay, good, thank you.
Thank you, Doctor.
Bye now.